Sunshine, it's our sunshine.
I am Dr. Venugopal Pareek. I am Chief Laparoscopic and Bariatric Surgeon at Sunshine Hospitals, Hyderabad. Today, we are going to clear some myths about bariatric surgery. The most common myth which people think is bariatric surgery is same as liposuction. No. Bariatric surgery actually is a minimal invasive surgery which is done onto the abdomen and which involves restricting the size of the stomach either by a band or by a bypass or by doing a sleeve gastrectomy or by implanting a gastric balloon into the stomach. Whereas liposuction, it is purely a cosmetic procedure. It is done by taking a small incision and sucking out the extra fat. So basically it's a shape modifying surgery. There occurs no resolution of comorbidities with liposuction, and multiple studies have proved that over a period of 2 to 3 months the weight loss effect which happens post liposuction are lost, and again the benefits which bariatric surgery gives in terms of resolution of comorbidity are not seen with liposuction. So liposuction is an entirely different procedure, not indicated for people who are obese, have BMI more than 30. Then the second myth. The second myth about bariatric surgery is that patients will not be able to eat any solids post bariatric surgery. No, this is absolutely wrong. Patients, we usually after surgery, we start them on a liquid diet for the patient to get accustomed to that small feeds which they take post surgery. But within 15 to 20 days, they will be able to take solid diet which they have been taking before surgery. So it's a wrong myth that you cannot take solids after bariatric surgery. The another common myth which is seen is post bariatric surgery your blood pressure and diabetes remains the same and there occurs no resolution. No. Multiple long-term studies have shown that bariatric surgery causes resolution of diabetes close to 90 to 95% of the population percentage at the time, and hypertension in almost 80% of the population. So someone who is taking like 100-150 units of insulin, most of the time the insulin can be switched off or it can be converted to simple oral hypoglycemic drugs. Whereas in terms of hypertension, most of the antihypertensives can be stopped. The other common myth which is associated with bariatric surgery is it's a life-threatening surgery. There occurs significant mortality in bariatric surgery which is highlighted in media. No. In fact, bariatric surgery is a very safe surgery and done with quite precision after the advances in laparoscopic surgery. The incidence of mortality is less than 0.1%, which is much better than cardiac surgery which is close to 0.5 to 1% or any other major surgeries. So bariatric surgery is an absolutely safe surgery. It is done with minimal access surgery and it done with a high precision. So the chances of mortality are much less than compared to any other surgeries. The other common myth which is associated with bariatric surgery is it is quite painful. It involves multiple large incisions. No. In fact, bariatric surgery is done with minimal access surgery. That means through small incision it is done. In fact, on the day of surgery itself, the patient is mobilized and within 2 to 3 days, the patient is absolutely discharged and within a week, they can be back to work. So, the myth that it involves big incisions and must be quite painful is absolutely wrong. The other common myth associated with bariatric surgery is that obesity is not a disease. It is just a cosmetic effect. No. The World Health Organization even has told now that obesity is a disease. So we have to consider obesity as a disease apart from the cosmetic effect, because it has been proved that with obesity comes diabetes, hypertension, your osteoarthritis. Now it has been proved that obesity is one of the most common preventable causes of cancer. So obesity is not only a cosmetic disease, it is a disease which needs to be cured. So let's join together and fight this disease of obesity. Thank you.
Sunshine, it's our sunshine.